Coming up next, CityNet 30 takes you downtown for the weekly luncheon meeting of the City Club of Portland. Live weekly coverage of City Club is produced through the facilities of Portland Cable Access. Now we join the City Club for this week's program.
Great if we could start questions, maybe like a 5 to 1. How long are your remarks?
They took me under 40 minutes, but they could run us to 30 something.
Okay. I will give you sort of 5-minute warning at about 5 till 1.
Okay. Oh,
So that'll
yeah,
be about
that'll
35. You'll have time. We have very few announcements to make today. Good afternoon. I'm Harriet Watson, President of City Club, and it's my pleasure to welcome you to today's Friday Forum on Medical Privacy in the Digital Age. Before we begin today's program, however, I'd like to draw your attention to the coupon in this week's bulletin asking for updated address, telephone, and email information for all club members. Please take the time to complete the form and return it to the club office by the July 3rd deadline. An accurate database of club members is critical to the success of ongoing club activity. Our board host today, seated at the head table, is Dan Findley, member of the Board of Governors and computer consultant with RHAS. He will ask the first question of our speaker. Following Dan's question, we will open the program to questions from City Club members in the audience. Please line up behind the microphone even before Dan is finished so that we have time for as many questions as possible. And the always admonition, please ask your question in 30 seconds or less. Broadcast of City Club programs this quarter is made possible in part by corporate underwriting from Portland General Electric, Schwabe Williamson and Wyatt PC, and Weyerhaeuser Company Foundation. We are very grateful for their ongoing support. And now to today's program on medical privacy in the age of genetics and the internet, or who wants your health information and why? As we all know, the explosion of online technology and the ascendancy of data miners in the workplace means that many people and organizations have ready access to our medical records and other personal information. This has understandably fueled public fears about the potential for Orwellian uses and misuses of personal health information. This has also spawned a new and often bewildering battery of buzz phrases such as opt-in, opt-out, pushing and pulling data. We are therefore very fortunate to have as our speaker today Mary Durham, Director of Kaiser Permanente Center for Health Research Northwest and Hawaii, and Vice President for Research for Kaiser Foundation Hospitals and Kaiser Group Health. Mary moved to Portland from Seattle 5 years ago, where for more than a decade she served as Deputy Director of Group Health Cooperative of Puget Sound Center for Health Studies. While in Seattle, she was on the faculty at the University of Washington School of Public Health and Community Medicine. In addition to her current roles at Kaiser Permanente, she has earned an international reputation for her independent research on mental health services for people with severe and chronic mental disability. Mary received her Ph.D. from the University of Oklahoma, where she specialized in medical sociology. She is a former commissioner of the American Bar Association, where she served on the ABA's Commission on Mental Health and Physical Disability Law. A prolific author, her most recent book, Back to the Asylum, The Future of Mental Health Policy and Law in the United States, which she co-wrote with John LaFond, has won high praise from researchers, healthcare policymakers, and state legislators. She recently testified before the President's National Bioethics Advisory Commission on issues of privacy and human subjects protection in research and clinical practice. In addition to her numerous professional affiliations and activities, Mary is engaged with the broader communities in which she lives and currently serves on the Board of Trustees for Portland's Self-Enhancement, Inc. But navigating the whitewater turbulence of today's healthcare and social environments doesn't provide enough challenge or excitement for this woman. She has also literally paddled the Arctic Ocean, the Yukon Territory, and 20 other Arctic and Alaskan rivers. In addition, she has climbed Mount Kenya, slept with lions in the Serengeti, and recently completed a 2-week solo trip in Nepal. It is my privilege to present to you Mary Durham, who will hopefully guide us through the rapids of medical privacy in the digital age. Mary.
Thank you very much. I hope those things prepared me for today's lunch with you. I'd like to thank Nan Newell and the program committee and members of the City Club for having me here today. Over the past 3 years, I've been talking to legislators, scientists, doctors, health regulators, and lobbyists, and other people across the country and in Washington, D.C., about privacy and confidentiality of medical data. I've been struck by the importance of the issue, and I felt like this issue is a time bomb that's about ready to go off. The signs of it are everywhere. In fact, last Sunday's New York Times had a feature article on privacy, and it depicted the issue as ready to explode onto the American electorate. Other newspapers and other types of media are beginning to feature many, many stories about privacy and the internet. Quite frankly, I think the fuse is burning and an explosion is at hand. And I don't know whether that will be a pop or a seismic event, but I do think it is worth some thought today, and I think it's a very, very important issue. So let me begin with what I believe is the key issue. People are waking up today to the fact that there is a great deal of computerized information, much of it on the internet, that presents an enormous threat to personal privacy. Huge volumes of information about you are already on the web and on many private databases. Your banking records, credit history, tax information, credit card purchases, and so forth are out there somewhere for someone other than you to see. And up to this point, I think people have been vaguely aware of this, and they've been extremely accommodating about it. But recently, there have been a number of widely publicized horror stories in the media, and people have begun waking up, perhaps roused out of their slumber by these horror stories and by politicians who have been pushing new privacy laws. So people are also realizing that there's very personal information about them that's floating around in cyberspace. And the coming revolution in genetics is going to make that even more complicated, and people are going to become even more concerned about privacy. The issue of medical privacy is extremely complicated, and there are many legitimate interests that are lining up to do battle on this issue. The pressures are building to pass new federal laws and state laws, and I like a good, juicy debate, so I'd like to begin that debate today. And I'd like to use this City Club as a forum to help frame the debate. There's a very active debate going on nationally about privacy in the internet, and it involves the FTC, the banking industry, telemarketing, healthcare, and many other interests. And legislation about medical privacy is also coming up in the next session of the Oregon legislature. And City Club members wield a lot of influence in this state. So if I can shed some light on some of the issues regarding this, then I feel I will have made a useful contribution to this. The new laws that we enact about medical privacy are going to affect everyone. The general public, businesses, physicians, and healthcare systems, and medical researchers. We have a great deal to gain, and we have a great deal to lose. And it's not going to be easy to create laws that foster all of these legitimate interests, but that's exactly what we can do, and I think it's what we must do. Here's one example, and the reason I got involved in this issue of medical privacy and confidentiality in the first place. I'm the director of a large not-for-profit research center. We use people's medical information to discover new ways to treat and prevent disease. Our mission is to improve the health of everyone, and so we publish these results in medical journals and other sorts of media that are accessible to both clinicians and to the general public. If new laws make privacy the highest and only value, then some types of research won't get done and can't get done, and we'll lose out on the fruits of those discoveries. So laws that seek to protect the narrow interests of one group will have implications for other groups of people as well. And later on, I'm going to give you some example of the law of unintended consequences. So why are we having this debate about medical privacy? We are now able to collect, store, and analyze data about millions of people. Data from public and private databases, including the internet, are revolutionizing medicine. People are worried that the information will get into the wrong hands and cause them either embarrassment or outright harm. And it's really not an irrational fear. And I'm going to give you two examples that some people are now calling data rape. Recently, an enterprising graduate student from Harvard University looked into the automated records of the state of Massachusetts and identified the governor of Massachusetts. There's another well-publicized case of CVS Pharmacies. This is an East Coast chain of pharmacies that shared its customers' information with a marketing partner. The firm then mailed letters to CVS customers reminding them to get their prescriptions filled and pitching new products. The letters that went to CVS customers said that the letter was supported by the drug company and mentioned a number of new products. When people got these letters at home, they said, "How did these people know I have diabetes?" So threats to privacy are everywhere, and they're getting more pervasive and perverse all the time. Two more examples that I'll give you that are coming our way by way of chip technology and the internet. First, computerized devices can now be woven into the fabric of clothing. They can be embedded in office and home walls. They can be built into appliances. They are being built into some appliances and connected to the internet to monitor consumer behavior and anticipate demand. So these sources really provide another input into data that can be captured onto the World Wide Web. Second, there's a use of a new technology called digital silhouette. Some of you may have heard about this. An internet company tracks your every move online in exchange for a free computer or maybe for a cheaper internet connection. Now, many people, especially poorer people, may feel like this is a fair exchange. but their web surfing behavior is then sold to marketing companies with their names and addresses attached. I think what frightens people about the internet is its potential to track extremely detailed information about our lives, and to do so cheaply and automatically, and to deliver it to anyone who has the information to buy it. And all of this can be done without you knowing that it's happening. And that's an unprecedented power in human history. And it certainly doesn't sit well on the minds of many Americans who really have a strong bias for individual liberty and privacy. But of course, these scary stories are the dark side of technology. Computerized databases and the internet are revolutionizing medicine, and they're opening up new doors for healthcare. Let me give you some examples. You're from Portland, and you're on vacation in Florida. Your husband collapses with chest pain. You take him to the ER, where the attending physician gets instant access to his medical records via the internet. The ER team learns that he'll have an adverse reaction to a drug that might usually be used with him. So they give him a different medicine, they stabilize his heart condition, and they save his life. Another example is that your daughter is diagnosed with chronic myelogenous leukemia, and that kills about 50 to 60% of patients within 5 years. And no one in your family has the right match for a bone marrow transplant that could save your daughter's life. In fact, only about 1 in 20,000 unrelated people have a match that's close enough. So how do you find a bone marrow transplant? In the days of paper mailings and telephone calls and inquiries to the media, you know how that takes place, and it can take weeks and weeks of very precious time. But today, you can go straight to the internet and click on www.marrow.org, and you get the website of the National Marrow Donor Program. And since that site was created in 1995, the register of volunteer potential donors has grown from 2 million to over 4 million people. And the site's computer system maintains the registry, tracks detailed patient histories, and manages all patient searches. And so now hospitals and bone marrow transplant teams can also search nationally and internationally to find that match. And some of those matches can be made literally in seconds. And finally, new developments in sensor technology make it possible to implant very small devices within people's bodies to monitor vital signs, things like blood pressure and cholesterol and glucose levels and so forth. And this can be transmitted continuously via the internet to the patient's physician. And this will put people in continuous touch with their doctors and provide much more accurate information in real time to your healthcare team. It's also going to make it possible to intervene in a crisis and maybe anticipate or eliminate the crisis altogether. As I said earlier, in the world of healthcare, there's much to lose and much to gain from the creation of electronic databases and the internet. Now that we've entered the age of the internet, what do Americans think about the use of private health information? If you asked, most Americans would automatically say two things. First, they would say that my medical information is more sensitive and more important than any other information about me and should only be shared with my physician. The second thing that they will say is that they want to give written, informed consent prior to the use of any of that information. In short, people's immediate response is an absolutist declaration about their concerns for privacy and their control of medical information. And I guess if those feelings in reality stopped there, we really wouldn't be having this discussion today. But when you probe more closely and ask people a bit more about these issues, a much more complicated picture emerges. The vast majority of Americans believe that there are federal laws protecting their medical records. There are not. There are state laws, and there are some problems with those that I'll return to a little later. They also don't know if there are laws that regulate and protect their medical information on the internet. There are no such laws. A survey of over 1,000 internet users showed that 33% think the government should regulate the web health sites specifically. Another 30% believe that the site should be regulated, but they're not sure by whom. And another 20% believe that the industry should be self-regulated. The majority of U.S. adults surveyed recently believe that computerized medical records are the most serious threat to medical privacy. More people, about 55% in recent surveys, worry about computer hackers than worry about authorized users who might leak information. When asked if they would permit various groups access to their medical records, the majority said no, except for research studies done by the government and academia. Interestingly, 70% said that they would not allow drug companies to have access to their medical records for purpose of marketing new drugs and healthcare products. People rightly worry about providing health information to any entity that has a conflict of interest. In another recent survey, 75% of respondents who sought health information on the internet were concerned that those sites with whom they registered on the internet will share their personal health information with a third party without their permission. In fact, many people do not seek health care information online because they have that concern. The three factors that have been identified as having the greatest potential negative impact on potential users are: one, if a site automatically collects information about the user; two, if a site shares information with advertisers or marketing partners; and three, if a site is sponsored by an insurance or pharmaceutical company. So just as the automobile transformed American society, the internet is going to reshape our entire healthcare system. The focal point of healthcare is going to shift from hospitals and medical offices to your home, to your office, and anywhere else you happen to be. It's going to change your ideas about where you get information and from whom you get that information. It's going to change the nature of the doctor-patient relationship, especially by putting more information and knowledge and power into the hands of the consumer. And it's going to change everything you ever thought of about what you call a visit to your doctor. But let me begin with a few facts here about the size of this phenomenon. There are now more than 10,000 websites dedicated to health. I sat down the other day for just a few minutes, and I used 6 different search engines, and within those few minutes, by entering the word health, I came up with over 9 million hits. Now, you might assume that those websites are all concerned with providing health information or creating online communities for people who have medical conditions, but these sites are very, very diverse. There was an article in the Oregonian, I think it was Monday, that featured 6 Oregon.coms, and it really demonstrated how wide-ranging these sites can be. Some of these companies are developing internet medical records. They're marketing health management products. They're providing practice management systems, products and services for providers, and they're creating health exchanges that will allow people to buy health services directly from providers using money that from their employee health benefits. And I suspect perhaps some of the representatives of those e-businesses may be here today. There's also a growing interest, a very great interest on the part of consumers in communicating with their doctors via email. I can tell you that many doctors are worried about this development. They're worried about how big that volume will get. They're worried about how quickly emails can be answered. They're worried about what happens if a patient dies between the time they send the email and can reply. And they're worried about whether there might be information that's extremely vital, even pertaining to a life-threatening situation, that might be contained in screen 30 of the email. And so there are many, many issues that have to be resolved in using email to communicate with your doctor. But it's a very important development, despite the fact that it's not at the present time a secure communication, and we'll have to develop the rules of the road for this type of communication to make this doctor-patient relationship work. Finally, there's a growing consumer involvement in the issue of medical record confidentiality, and there's a growing public movement that is about individuals gaining control of their own medical record. A number of companies I mentioned, a number of them here in Oregon, but around the country as well, who are developing computerized medical records. And at this point, a very small proportion of people have become interested in this, but it's definitely a very growing and powerful consumer movement. There's a new journal in town. It's called the Wall Street Journal. Have you noticed the attention that medical research has been getting from the national media and virtually every local newspaper of any size at all? The public is very, very interested in the bounty of research. The nightly news, newspapers and so forth, are devoting a lot of time and attention to this topic. And despite the attention that has been lavished on researchers recently, we researchers have done a very poor job of explaining to the American public what will be lost if access to data is cut off to protect confidentiality. It's only a slight exaggeration to say no personal data, no preventive care. If the public's concern about the privacy of health information results in laws that deny access to anyone other than the person's personal physician, then scientists will not be able to carry out research that leads to medical breakthroughs. Here's an example. Here's an important example. Before a new drug or vaccine is approved for use, it has to go through years of testing. The last step is a clinical randomized trial that tests the safety and effectiveness of the drug or vaccine. It's typically done on 1,000 to 2,000 people. If the drug works and there are no apparent side effects, the drug is approved and it goes to market. Then it gets prescribed to millions of people, most of whom have different characteristics than the 1,000 to 2,000 people on whom it was tested. And then as millions of people take the new drug, pharmacies record who's getting the drug and how much they're taking, and physicians record how it works with patients and what side effects appear. All this gets put into large databases, and researchers use that information to analyze how safe and effective the new drug is. What would happen if researchers couldn't analyze those data? Remember thalidomide? In the 1960s, women took thalidomide to prevent nausea during the first trimester of pregnancy, and it was very effective. But in the 1960s, electronic databases didn't exist, and it took years for scientists to find out and then prove that thalidomide caused horrible, horrible birth defects. I don't think we want to return to the old system where individual physicians write down a possible side effect on a piece of paper and then mail or perhaps fail to mail this information to the Federal Drug Administration or the Centers for Disease Control. The agency then waits for enough reports to trickle in before they order a new study, which takes even more time. Databases allow researchers to spot troubles early on and analyze potential problems quickly and efficiently. The recent event in which a combination of diet drugs called fen-phen was found to cause heart valve problems is a very good case in point. Viagra, which I'm sure you've heard of, is also another case in point where the FDA acted swiftly once the drug got on the market, and they may ask for new studies. They may actually take the drug off the market if there are serious side effects that pose health risks. And just as important, databases make it possible for us to find out if a new drug or vaccine is effective and how it's actually being used and what people it's being most effective for. So electronic databases are absolutely essential for scientists to create the next generation of discoveries that are needed to transform healthcare. And we need these bases to move from sick care to preventive care. But databases come loaded with questions and problems. And here's a question that goes to the heart of the privacy debate. Do researchers need a signed consent form from each individual whose health information is embedded in large computerized databases? This is an extremely complex question, and I'm going to return to it at the end of my remarks. But what I will say is that if written consents are required on all types of research, the cost of some types of research will be so prohibitive that that kind of research will cease to exist. Another problem. Medical databases have to be sent over electronic airwaves so that researchers around the country and around the world can analyze the data. And this puts databases at risk for security breaches. Another problem. It's called the World Wide Web for a very good reason. Data transmission makes a mockery out of state boundaries and national boundaries. The problem is that states are political bodies making the laws about data privacy and transmission. We have 50 different sets of laws created by legislators who are making policy for geographical political entities in a virtual world. It makes no sense and could freeze our nation's ability to do research. It could make it impossible for that physician in Florida to get access to data when you go to the emergency room in the case that I mentioned before. Genetics is the most scary case for health information. Many people believe that genetic information is different than other medical information and must be treated differently. But every disease or medical condition, with the exception of some types of trauma, has a genetic component. Clinicians now realize that medical records can't be separated, or even descriptive information kept separate, like blood type or family history, from genetic information. So genetic information is going to be contained in your medical record. And the genetics revolution has just begun. Some people are concerned about eugenics programs. Other people foresee a chance for eternal life. But it's simply too soon to know what this revolution is going to bring. The human genome which is now nearly complete. In June, the early entries in the human genome are meant to be published. But it's only a starting point. It's really the equivalent of a periodic table in chemistry. Solving the puzzle of the human genome is really much left to be done, and those interactions have not yet begun in earnest. Massive amounts of work and money to develop the interventions, genetic interventions and treatments has yet to be done. Now, the possible benefits of the genetic revolution are vast, and I'd like to give you just very, very briefly 3 areas of research that will profoundly change medicine and healthcare over the next 10 to 20 years. The first benefits will come from genetic screening tests to identify who is at risk for developing specific diseases. Francis Collins, who is the director of the Human Genome Project, claims that we'll have maybe 25 tests predicting medical conditions within the next 10 years. I think that's a very modest estimate, and there may be many more. Despite what you've heard, gene therapy is a very promising area. For example, we may soon be able to cure cystic fibrosis by introducing normal genes into people's lung cells so that cells can produce normal proteins. Pharmacogenomics is the term that you're going to hear a lot about in the coming decade. People react very differently to drugs. This is why physicians do a lot of trial and error to get a drug that will work for you. Using genetic profiling, though, your physician will be able to know which drug will work for you and which will cause an adverse reaction. In other words, drug prescribing will be customized to match up with your unique genetic profile. Imagine the possibilities of this. But the genetic revolution also brings risks, obviously, and risks for individuals and risks for society. Genetic information reveals vulnerabilities not only about you, but past and present members of your family. People are very rightly concerned about the misuse of genetic information because it can potentially lead to discrimination in jobs and housing and insurance. People can now be denied life or health insurance because of pre-existing conditions. Will they also be denied jobs if they have a genetic condition that puts them at higher risk for developing cancer or depression or any number of diseases? Some people fear that genetic screening will lead to eugenics. There are really 2 concerns here. One is that couples or individuals will use the information about their genetic risks to make decisions about having children, or will use fetal genetic information to make decisions about abortion. They may also take advantage of pre-implantation genetics to allow them to select the characteristics in a child. Just think about that. The other concern is that people will have specific genetic predispositions will not be allowed to have children. And you may think that that's unlikely, but the risk is there. A third concern has to do with genetically developed medicines and treatments. These will be very expensive. They will probably and undoubtedly exaggerate our 2-track healthcare system. Genetic medicine will be available to wealthy people, and traditional medicine or no medicine will be available to those who can't afford genetic medicine. And I guess if this happens, the economic forces will create its own eugenics program. And as I said, the genetics revolution has already begun, and short of banning this type of research, there's really no going back, and nor would we want to go back. But the issue is how to go forward now that the genie is out of the bottle. If genetics is the most scary case for health information, it's also one of the most lucrative areas for research and development. It is here that personal privacy and business enterprise collide. The battle lines are clear: my genes versus patents on genes. On one hand, the personal privacy viewpoint has several aspects, because people feel that genetic information is so sensitive. Some people do not want to share it with any business organization anytime. Other people want to share in a share of the profits if businesses develop products that become profitable, things that are based on their tissue or their genetic information. About a month ago, a woman in the Midwest filed for a patent on her own genetic code on the grounds that her genetic makeup is unique. On the other hand, the business viewpoint has a clear economic imperative. It now costs hundreds of millions of dollars to bring a new product to market, and it's going to cost millions of dollars to develop genetic tests that will lead to new drugs. So unless there's a potential for profit, businesses will not develop genetically based medicines. And unless they have something they can patent, drug companies are not going to invest money in research for these new products. What drug companies and biotechnology firms have been doing thus far is filing patents on genes. The genetics revolution involves a collision among private, business, and governmental interests and capabilities. Up to now, the first principle of the new genetic age has been the private sector should be the lead because government is too slow. Governments are geared to the industrial age. They are geared to an industrial economy, and they're geared toward national borders. The new technologies are starting to move from the speed of sound to the speed of light, and they're indifferent to national borders. The contest between Craig Ventnor's Celera, the for-profit business that's dealing with the human genome, and the government-sponsored Human Genome Project is a perfect example of this. Business has been in the driver's seat in the genetics area so far, but the profit motive is too blunt to serve the cross-cutting interests of all of these potential competing interests. Clinton's first executive order of the new millennium was to outlaw job discrimination based on genetic testing. This is a laudable step, but is a rather rearguard or defensive action. Government needs to do more than prohibit specific behaviors. It needs to create policies that foster personal privacy and research discoveries and business developments, because these developments will outpace our ability to craft useful policy. How many of you know about Oregon's genetic privacy law? Okay, I'm surprised so many of you know about it. This is a complex law that was passed in the 1990s, and it makes body tissue and blood samples the private property of the individual. One of the things this means is that you can't be required to give up your property rights when you join a research study. You can sell your property and you can give it away, but you can't be forced to give it up. So any organization conducting a study using your tissue or blood could be forced to share some or all of the profits of the products that are developed. So what are the unintended consequences of a law like this in Oregon? First, if you sell or give away your property rights, you no longer have control of any future use of that property. Second, the law is reportedly driving biotechnology firms from the state of Oregon. Firms simply are not willing to invest money in genetic products when they risk losing all or some of their profits in a court case. So they're doing the research and product development in other states. So how can we reconcile these competing interests? I'm going to end by making a number of suggestions, and I make these to invite discussion and debate. First, and my first suggestion is really a no-brainer. Pass non-discrimination laws now. jobs, life insurance, medical insurance, loans, and housing, and put real teeth in these laws. Second, pass federal, not state laws about privacy and transmission of health data. We now live in a web-driven world, and we need federal preemption of state laws to achieve uniform laws and policy. State boundaries are meaningless in a virtual world. Support the efforts of the Federal Trade Commission to get high-tech industry to enforce fair information practices on internet sites. In addition, support the creation of code-based solutions to the problem of internet privacy. These are standardized computer-readable codes that can let consumers express their privacy preferences in ways that computers will automatically respect. Break the Department of Defense's lock on personal, research, and business use of state-of-the-art encryption programs. These can be regulated so secrets don't fall into the hands of terrorists. Require very high levels of encryption. For example, today it is triple encryption, and this should be a standard that's a minimum for sending health data over the internet, and keep ramping up this standard as new technology becomes available to make it tighter. Research studies are monitored by independent review boards, so-called IRBs. Strengthen IRB capabilities and oversight of data-only research, including the issue of anonymized data, to protect individuals' privacy. This will cost more, but it's worth it. Electricity is everywhere, and you don't patent it, but you can patent uses of electricity. In the same way, permit patents for uses of genes and gene sequences, but do not permit patents for genes or gene sequences. Permit patents on gene functions only when the patent requesters can prove they've done work on those functions. So no fishing expedition patents. Keep patients well informed when they see their physician, and give them a choice about future research and the use of tissue, data, or results from their medical tests. Give patients easy and ready access to their medical records, their control. Thank you so much for having me here today. I'm looking forward to your questions and to a very lively debate.
Thank you, Dr. Durham. I have a question concerning the quality of the work that's being done by the local .coms that you alluded to earlier. Is the work that they're doing in terms of making it possible to share information exemplary in any way? Is this going to be something that will help us all have a more secure environment on the internet for sharing information, or are they just dropping the ball?
I think everyone in the health industry knows that confidentiality is an extremely important problem. And so what's happened is that e-commerce in health has really been exemplary in setting the highest standards. In fact, one person who works with me told me that if we could keep ramping up the level of encryption to keep pace with the level that is being used in health sites on the web, then that would be a pretty good way to keep pushing those standards. The problem with the web, of course, is that this is all voluntary. And so it's been, I think, quite exemplary at those sites, but it's due to their realization that they could not have a business if people were uncomfortable with that level of security.
Dr. Durham, thank you. It's been a fascinating presentation. I'm Deborah McKay. I serve on the healthcare committee here. As a patient and as a future medical provider, I'm concerned very much with privacy and what's coming forward. My question is there any reason for us as consumers and patients to expect reasonable electronic anonymity that's under our own control? any time in the near future?
Anonymity is a big, talk about hot buttons that are getting bandied about these days. Anonymity is something that is very difficult and perhaps impossible to guarantee. The reason, and that's why I like the example of the Harvard graduate student so much, the database that she was going into was a public database, but it was, quote, anonymized. But what she did is that by selecting ever smaller cells, as researchers would call them, or excluding other people, she got to the point of finding a male in a certain age group that had a fairly unusual medical condition during a certain time period. And so it has really raised the question to a lot of people about whether we could ever have truly anonymized data. The jury is still out on that. It's highly controversial. But I do think that we need to make a very important distinction between anonymous and confidential. And that's where we need to, as a public, decide what is important, with whom should those data be shared, so that we can have a say in who those individuals may be. Some people will want to be included in research and others won't. And while I'd love for everybody to be included in those databases, and I think the public loses if we don't, it still should be an individual's right to choose. And I think that we'll eventually get there. And luckily for us, the technology will probably help us. I can talk about that if anybody would like to hear more about it. But the technology actually helps us to weigh in on what level of privacy we want for our own records. And that may be the big breakthrough that comes to us once again through technology.
My name is Blake Rohrabacher, City Club member, Healthcare Committee member, and actually a representative of one of the Oregon health.coms. And I assure you that we definitely understand the issues at stake here, and we are compliant with the HIPAA regulations as they stand. All of our data is encrypted and is the user can choose what type of access. And my question is there is definitely an awareness of the privacy problems of health on the internet, but there's also kind of an under people are not realizing that health data in the real world people underestimate the security of real world health data, where there is no one, maybe one person in the entire world who could get the data that is in our databases because it's behind the firewall technology and encrypted, but anybody who walks by the file cabinet in your doctor's office or your hospital can get your medical information.
Right. There are some notable differences between paper records and computerized medical records. There's always been that risk that someone will look at a medical record that when it's transported from point A to point B, it could be lost, destroyed, dropped, whatever. But I think it's the volume of and also the multiplication of the information itself that's very scary to people, and people can express kind of their own concerns about what it is. But the paper medical record, especially before the days of Xerox when it might not be duplicated, resided in a single place. And that's a very big difference. Instead of on the screens of perhaps many people that are in a healthcare facility. So there are some interesting comparisons that make it different, I think. And we have to recognize the potential for those differences and how frightening they can be.
Dan Goldie, member. Thank you very much for a very enlightening talk on a very complicated subject. My question relates to the point you made about the importance of the federal government preempting the states because of the nature of the regulation that would be needed to provide privacy. And my question goes to the recent 5-4 Supreme Court decisions, which have set aside most recently the Violence Against Women Act on the grounds that the federal government cannot enact statutes of that sort under the Interstate Commerce Clause. So I ask you, is the present majority, conservative majority, 5-4, on the Supreme Court a threat then to the enactment of the kind of legislation that you see as required to deal with the privacy issue?
Well, I must admit, I'm not a lawyer, and so I can't deal with the technical issues associated with that, but although I've said that I believe that we should have federal preemption, I'm not very optimistic that it can happen. As we looked at the legislation in its various versions that has come up, or it's been in committee in Congress, there has been so much dissension on these issues that nothing has emerged at the federal level. In the absence of that, states are very concerned about doing something, and so they will take these up at the state level. And so I certainly don't blame states for doing that. The difficulty is the boundaries issue. As a researcher, I do research, and the people I work with do research with people all over the country, really all over the world. And if Maryland data has very narrow rules about how to transmit that information, and California has a different set, if certain wording has to be used in one state and something else in another, there are some studies that I have talked to researchers about recently where the study couldn't be done. The work couldn't be done, and in the end, all the data could not be put together. And if you can't do that, some of the studies that have been done are worthless. And so I'm not optimistic, but I do think that as far as many of these issues concerned, we can't do it in the 50 state legislatures.
Mary Ted Falk, member, and one of the problems with standing behind Dan Golding is that he sometimes asks your question for you, but I'd like to continue the debate on federal state issues, because it's really a critical issue right now. I wonder, first of all, whether you think that Oregon and other states have done a service by raising issues about confidentiality that were not recognized elsewhere and therefore have served this classical function of being the laboratory of democracy. And that's maybe a leading question.
Gee, isn't that a leading question?
and second of all, just reflecting on the paralysis that has gripped the federal government over the last 25 years over confidentiality issues, why do we think it would be any different in the future, and don't we have a responsibility just to act where action can be taken?
I think that that's what's going to happen. I think that, well, we've seen that actually, because there hasn't been any resolution at the federal level, states have done this. It just creates the situation that I've described, and for many things, aside from just research, it's also transmitting clinical records back and forth. It presents the same problems. I do think states are grappling, and Oregon has done a very good job of grappling with the issues as we work together on the Genetics Research Advisory Committee for the state, and we're really puzzling over the property issues and the privacy, other strategies that include privacy protections and penalties for those. And so, we're recognizing how complicated these issues are. They're kind of smarter than we are, and I don't mean as a group. I'm talking about just the basis of the law and how we might choose to resolve those issues. So I think states will have every opportunity to continue delving into these issues because the feds won't do it, but it's still a shame that they won't.